When there is no public money to pay for medicines or salaries for nurses and doctors, and international health funding is plummeting, we are putting countries under pressure to rapidly fund their own health services, sometimes unrealistically. Sick people have to pay for medical care from their own pocket. It's called user fees. But what if their pockets are empty? What if they're vulnerable or affected by AIDS, tuberculosis, or malaria? What if they're in a country at war or facing a medical emergency? What if free care is a policy in their country but is not applied in reality? Yes, you guessed it right. These so-called user fees create horrendous suffering. It means people dying because they cannot get healthcare. Patients will suffer due to incomplete or substandard treatment. Children will not be vaccinated. People with chronic diseases are left undiagnosed or stop their treatment. Patients are imprisoned in health structures until they can pay. Entire households get into debt or have to sell their means of livelihood to find cash. It can also mean a greater risk of epidemics spreading unnoticed and infecting more people. As an example, in the Central African Republic, a country facing a humanitarian crisis, many women have to pay to give birth. The cost of one delivery could instead feed a family of 4 for 1 month. In the Democratic Republic of Congo, some HIV patients stop what should be lifelong treatment because of the cost. As a consequence, they become even more unwell and in need of even more expensive care. In Afghanistan, almost 50% of patients have to sell goods or borrow money to pay for healthcare. Yet there are plans to reintroduce user fees, starting with hospitals. In Guinea, where malaria is endemic, an MSF-supported project providing free healthcare increased the number of people seeking care by 10 times. The world is committed to reaching universal health coverage by 2030. It's more than time to act, and to continue taxing sick people is not an option. If we are serious about making universal health coverage a reality, if leaving no one behind is to be more than just a slogan, user fees must be removed from health financing policies. Health is about saving lives, and free care saves lives.